We also have had a commitment in the past to use the board meetings to focus on areas that are important to us, that represent areas of opportunity for the institution, that bring forward cutting-edge programs, that we can highlight aspects that are important to the board. One of the areas we often talk about is the area of big data. Everybody's heard the term big data. I don't know what that suggests to everybody. I think it usually means massively large sets of data. And everybody talks about it. We've moved nationally and internationally in science into a time when people have many more abilities to collect data than they really have to analyze data. So we can collect and track reams of information, but it doesn't really matter unless you have some way of organizing, synthesizing it, retrieving it, using it, and making it a part of the way you do business. And so we decided, at urging of the board members, that we'd focus on a couple areas in our own institution where we have real leaders that are looking at the use of data, that are using this to create information that can be put to use in the development of new discoveries, in the way we do our business. And so we're going to have two presentations in that area today. So it's really my opportunity now to introduce our first presentation of the UNC-Chapel Institute. John, is it Buse? Buse, thank you, John. I'm sorry, I should have known that. Who's an MD and a PhD, is a co-principal investigator and director. And the mission of UNC-Chapel is to accelerate clinical and translational research from health science, from discovery, all the way to dissemination to patients and communities, really trying to do the entire process. So thank you very much for being here today.
Thank you so much for allowing me to present to you. This is really a huge opportunity for us, the North Carolina Translational and Clinical Sciences Institute. At the end of the presentation, I'll introduce Dr. Angie Smith, who will talk a bit about what the TraCs Institute's been able to do with regards to her career development as an investigator, focusing in bladder cancer. So the overview of the presentation is, I'll tell you a little bit about how we're structured, the scope of the effort, which is enormous, the collaborations that we have across the state and the nation, a very little bit about our work in commercialization and making sure that we have programs that innovate, but also engage the world in a commercial way. Talk a bit about workforce development, a new and emerging theme for us, and focus a bit on our efforts in diversity before introducing Dr. Smith. So the North Carolina Translational and Clinical Sciences Institute, which we call UNC-Chapel, the purpose, to distill what Chancellor Folt just said, is really to improve human health by making the process of discovery and implementation faster, better, and cheaper. We have a lot of infrastructure here focused on improving human health, and what the TraCs Institute is really engaged in is catalyzing that effort. This is a diagram that attempts to depict what we do. I'll get to the little dots in the middle in a second. Those are our so-called resources and services, sometimes thought of as cores, but we try and focus those energies in three areas. Drugs, device, and diagnostics development, developing new drugs, new tests for diagnosing and following disease, new tools, devices for surgical or other implementation. And then we have something called transformative technologies. That's largely driven by those big data issues that we talked about before, so genomics, metabolomics, proteomics. We now have the ability to measure millions of things in individual people serially over time, and trying to mine that data in a way that we can have meaningful insights is really critical, not only for discovering new diagnostics, but also for determining whether we can predict the course of a disease, which is very important for accelerating drug development. And lastly, comparative effectiveness, doing research to compare the many, many treatments that are already available to see which are best, particularly for individual people, or particular groups of people, and using those insights to inform the other efforts as well. The folks that do most of the work are collaborators across the university and our partners, so they include individual investigators, research teams, and particularly trainees and scholars. Our academic world is a partnership between the University of North Carolina, North Carolina State, North Carolina A&T State University, and RTI International, a nonprofit research institute in Research Triangle Park. And the folks that we engage nationally include a consortium of 62 other CTSAs across the country, as well as large clinical networks across the country, and our community here in North Carolina as well. So these resources and services in the middle are sort of the nuts and bolts of doing this kind of translational research, where you go from the bench to the bedside and into communities. And I won't go through each of them in detail, but I would just point out that we have everything from ethics, making sure that the work we do with people is conducted in an ethical way, to biomedical informatics, that's the big data science of what we do, to pilot award programs where we give out dozens of awards every year, over $10 million over the last 8 years to accelerate new knowledge generation and our training programs. And some of these are housed at UNC, and some of them at Research Triangle International, or RTI. The North Carolina TraCs Institute was formed as a result of the so-called Clinical and Translational Science Award from the National Institutes of Health in 2008. We successfully renewed that grant in 2013. The current 5-year award that goes through 2018 is nearly $55 million from the NIH, and it's matched about 1-to-1 with institutional resources, both here at UNC and at RTI and North Carolina A&T. There are about 300 faculty and staff that are wholly or partially supported by NC TraCs, and it was just wonderful, as I was thinking about this presentation, to get an email last week, someone commenting about going one of the far-flung areas here at the university, far away from our offices in Brinkhouse Bullet, that they had run into a TraCs investigator making a presentation. They said, you can't throw a rock on campus without hitting TraCs. So we truly try to integrate across the university. These are some of our accomplishments. We've engaged over 3,000 investigators, completing almost 11,000 individual requests for help. We've assisted in almost 1,000 publications, 150 FDA submissions. We've assisted 69 startup companies. And data that's just through 2012, when we did our last renewal, is that we'd assisted with almost 1,000 research proposals, and most amazingly, almost 60% of those grants were funded. You may know that nationally, the success rate in funding grants is less than 20%. So I think we've been effective in amplifying our effort. And the total amount of those funded grants is almost $150 million. But again, that data is almost 3 years old now. The major collaborations, again, RTI and North Carolina A&T became partners in 2013. We selected RTI because they have very complementary strengths and focus. So we've selected particular things that they do well that we had lesser programs. So as an example, metabolomics, one early drug discovery. It's not that UNC didn't have it, but they had it in a bigger way, more integrated with FDA processes. And their focus is very different. And so we thought we would learn just about how their culture is different from ours, and that's been a very productive partnership. And with North Carolina A&T University, we felt that there were huge opportunities in workforce development. We can help their faculty and students that are focused in translational science do things better, be more successful. And also, since most of their programs are not PhD programs, we can provide a pathway for their master's students who are interested in more advanced study to seek that here at UNC. We have particularly strong collaborations with Duke's CTSA. So they have a parallel institution at Duke. We are engaged in huge data sharing projects, and over the last few weeks have heard about millions of dollars of additional grant awards to help us really cement those ties across the state of North Carolina and even into South Carolina. We've advertised joint programs for research. We've had 27 research teams that involve both UNC and Duke investigators emerge over the last year. We conduct joint symposia and training sessions, and we've shared with each other our best practices for how to get this work done efficiently and effectively. With North Carolina State, we work in collaboration with their joint program between UNC and North Carolina State on biomedical engineering, with the veterinary school and the Center for Comparative Medicine and Translational Research. And across the state we're engaged, and I'll show you two little diagrams in a second. And then lastly, remember, we have 62 of these CTSAs funded by the NIH across the country, and our evolving mission is to further engage them, and we have ongoing collaborations with 39 of those 62 CTSAs. So this is just an image from our 2013 grant application where we looked at what research programs were we doing, either basic development, clinical trials, or implementation science in communities. What were we doing across the state? And you can see that essentially every county in the state is engaged in some way in the programs that we run. And when we look at the individual people that volunteer to participate in our clinical research studies, again, those people largely come from this immediate area, but literally across the state in every county and across the nation and the world. And I wanted to tell you about our Innovation to Impact programs. So these are programs where intellectual property developed here on this campus is accelerated in a way to create companies. And I'll tell you a little bit about the story of Spirix Biosciences. Now, most people thought of TraCs, our institute's role, is providing small grants to help people get the data that they need to launch a commercial venture. And certainly we do that. That's the so-called Kickstart Commercialization Award. And it helped Spirix pay for critical patents and synthesis of lead molecules that can be used in actually doing the studies, first in animals and then in man. But our engagement started way before that. Now, way before in the timeline of a company, but it's really just a 2-year period of time where we helped them form the company through our so-called NEO program, a program that's really designed to help investigators turn into entrepreneurs. And we incorporated, we helped them with their incorporation. We developed a suite of services for them involving IP experts, intellectual property finance, and helped them get a small business innovation research grant from the NIH. As a result of that, this company, 15% of the equity is held by the university. We helped them establish their board of directors. We helped them recruit a CEO and a vice president for product development, and we helped introduce them to a variety of venture capital folks. And as a result, just in May, they got their first Series A funding with $18 million, and they're well on their way to developing novel therapies for respiratory diseases. That's one of 69 companies that we've helped. Workforce development is something that we're being pushed to do. It's something that we have been engaged in all along, but increasingly at the NIH, this is a focus. And we have looked at our workforce development goals as being very broad, from developing the public and their role as volunteers in clinical research, all the way to specific investigators with specific skills like biostatisticians and epidemiologists. What we're trying to accomplish in each of these areas is a little bit different. So in the public and the general healthcare environment, we're trying to inspire the concept that research is really a public good, and everybody should engage when they have an opportunity to do so. For the implementers, the clinical trial coordinators, data managers, pharmacists, there are hundreds of different job descriptions involved in this kind of work. We want to provide them more practical training to make sure they do their job well. And lastly, we want to focus on creating the next generation of wizards. How can we engage underrepresented minorities? Well, this partnership with North Carolina A&T that I've highlighted already has really been powerful. I think there's a lot of opportunity moving forward there. We have major programs in community engagements to build partnerships between communities, faculty, and healthcare providers. And two specific ones there are to help junior faculty development at North Carolina Central University and engaging the Latino community in research. But it's probably our single biggest spend from the TraCs Institute. And lastly, with the issue of workforce development, I wanted to introduce Dr. Angie Smith. Why don't you come on up? So she's a KL2 scholar, one of our programs. She's an assistant professor here in the Department of Surgery and focuses on bladder cancer treatment. I'll have her tell you a bit about how the KL2 scholar program works, and particularly works for her.
Thanks, John, for the introduction, and thank you to the board for inviting me to speak. I'll just speak for about 5 minutes about my research and how the KL2 and NC TraCs has really impacted that research. So to begin, as John mentioned, I'm a surgeon, and conducting research in the surgical world can be challenging because, as you might imagine, surgical departments, it's more lucrative for us to operate rather than do research. So we know, however, that research is important in advancing the field, and that's probably why surgical research lags far behind that of medical research. So I was very fortunate at the very beginning of my appointment about 3 years ago to be awarded the KL2 because that provided some pilot funds for me to conduct my research, but also protected my time as a surgeon so that I can start my career as a researcher. So as he mentioned, I work with bladder cancer patients, and bladder cancer patients are generally elderly patients who can be sicker. Invasive bladder cancer requires this major complex surgery. You remove the bladder. It's very life-changing. You remove some pelvic organs, and then you basically take a piece of bowel and fashion it into a new bladder. So you can imagine it's a very complex operation, multiple complications, and can be challenging for patients. And what I noticed as a resident was that I was getting the same question from my patients over and over again, and that was a very simple question: how will my recovery go? When will I become back to my, or when will I come back to my baseline, or will I become back where I was before surgery? And I realized we didn't have an answer to that. And what a simple question. Shouldn't we know that? We've done thousands of these operations. It's not a new operation. And yet we didn't know. And so that really spurred my research. As Chancellor Folt had mentioned, collaboration is the key to thriving, and NC TraCs really they support that. And so I was provided with some mentors in the geriatric oncology field, medical oncology, which helped identify a way so that we can track these patients before and after surgery to give them that answer. So what we did is create a battery of tests, and we gave them before and after surgery, and we found that certain things, for example, activities of daily living, going shopping, they take a hit at 30 days. Patients aren't really doing that, but at 90 days, they get better, and they can get back to those daily living activities. Whereas other things like memory and cognition took a hit 30 days and worsened at 90 days. And so these are things that I think patients need to know because they have to make decisions of whether they're going to undergo surgery or perhaps a less efficacious treatment, but that preserves their quality of life, such as radiation. So that spurred my research there. Of course, research begets research, and more questions came about because a lot of my patients were having complications, readmissions, not only my own, but others as well. And so that spurred my next research endeavor, which was to look at predictors of complications and readmissions. And what we found was that among patients, general surgery patients, for example, undergoing the esophagectomy where the esophagus is removed, pancreas where the pancreas is removed, or pancreatectomy, and then cystectomy, readmissions were about 1/3 of those patients, and cystectomy was the highest at 43%, which is a staggering number. Almost half of these patients were being readmitted. And we know that as a nation, that's a huge problem. $20 billion we spend annually on patients who are readmitted to the hospital. So I really wanted to gear my research now to identifying an intervention. How can we fix this problem? And so we found that one way to do this is to engage with the patient more frequently, not making them travel to us every week, but rather almost travel to them. One way is we used telephone intervention, calling them, asking them how they're doing, and that was received with great success. And now we're moving into the IT world, using online surveys, symptom surveys that can trigger a page that's sent to the practicing physician to let them know when a problem's occurring before it escalates to the need for a readmission. So that's where we are with our research, and I want to just end with how the KL2 and NC TraCs has really integrated into my research agenda. And the first is about resources. NC TraCs provides a number of resources, not just protected time, but also grant writing workshops. They provided me the ability to get a master's in clinical research, which will serve me well as I conduct my research and move forward with my career. And I have to say I have a lot of colleagues in other institutions because of the collaboration. I'm working right now with Vanderbilt. We're going to be putting an NC TraCs pilot award together because they have a CTSA, and so we can collaborate together. But I do talk to a lot of these other researchers at other institutions, and UNC is unique. And I say that because even though on paper these CTSAs look very similar, I would say that UNC really provides a lot more resources than I noticed from a lot of my colleagues. And I can say my husband's actually a researcher at another institution that shall not be named nearby. And we often compare and contrast our research experiences, and he sometimes uses the resources that I have, and I can provide to him because really I have much more support here at UNC. So I'm very grateful for that, and that's why I'm here today. The second thing that I'll mention, and it's not really obvious because you think about research, it feeds back into leadership development, and it also feeds back into national recognition. So for me, I'll just give you a couple examples. Through the grant writing workshops we've had, I put in for a PCORI award. So PCORI is a Patient-Centered Outcomes Research Institute. It's a funding organization. And they have these engagement awards. They've only actually given out 10 in the last 2 years. And so I was fortunate enough to be awarded one with the help of NC TraCs. And so that was a great opportunity for myself, but a great recognition for the university as well, since this was the first engagement award they had. But from that, a lot comes from an award like that. And so now I'm recognized as an expert in patient-reported outcomes in the bladder cancer arena. So in the last few months, I was approached by the Society of Urologic Oncology, a national organization for urologic cancer research, to head their health services research planning committee. I was asked to be an expert speaker there. I was also asked to be an expert speaker at the Bladder Cancer National Conference. And then the last 2 weeks, the American Urological Association, which is our national organization, asked me to chair the bladder cancer portion of their bladder health committee. So these are just some examples of someone who is only 3 years in. I'm very fortunate to have had the resources NC TraCs has provided, leadership development, et cetera, to really launch my career. So I hope that I've provided some, examples of how helpful it has been to me in my career, and I'm sure many, many others. And again, I'd like to thank you for the time and your attention.
So, and I just close by saying that, Angie is wonderful and has done amazingly well over the last 3 years. We have 15 to 20 people that are pretty much in the same place in the process. That turns over every 3 years. And over the last 20 years that these kind of programs have been conducted, over 96% of these young scientists stay in the field, continue pursuing research, whereas nationally the statistics are much, much worse, maybe 30%. And most of them have been successful in getting the highest level of funding from the NIH and other federal institutions. So we're very proud of Angie and all of our KL2 scholars. So that was it for us. I don't know if there's time for questions. I know we've gone a little long.
John and Angie, thank you. It's nice to know how all this connects, because you assume a lot of this goes on, but you don't know exactly how it interconnects, especially within the state with other organizations, and I think it's great. I did have a question. When you get into research like this and a company pops out of this thing, and you mentioned that the university owns 18% of a specific piece of a new venture, maybe Lowry, I'm just curious where in the university that's held. Is it within the research area and it stays there to fund further research? How is that, how is that?
Well, having never actually done this myself, I'm not sure.
Judith, that would be Judith.
Yeah.
Tech transfer, okay.
I think some of the resources go back to the investigator's home department.
Yes.
And some of it are held at the university level to be able to do this over and over again.
Great.
We have Chapel Hill actually is quite generous in the extent to which it distributes this, because I think we've always looked at it as a way to fuel that intellectual, just exactly what you talked about. You invest a little and look what comes back. And so a lot of that funding is what goes back directly to fund the activities or directly to the researchers and to the science. So it's a pretty good collaboration.
It is kind of amazing when I think about it. My job basically is to spend around $20 million a year without actually doing the science, just helping people who could do the science better. And we could spend $50 million doing this. It is awesome how much opportunity there is by bringing people together that are working in different areas, giving them a little bit of money to be able to get things started, and then we've been very successful at getting lots of support from outside the institution. And through work with the Office of the Vice Chancellor for Research, in general, it is pretty impressive how far we've come over the last 10 years, particularly in the commercial area.
Mr. Smith, you've been at this for about 3 years, and the baseline was a 43% readmission rate. Do you have a feel for how your work has impacted that, or how it could impact that 43%?
Yeah, so from the research that we looked at a national database and looked at reasons for patients' admissions, and at least half of those readmissions appear to be preventable. So these are the problems that are occurring at home and just sort of escalate. The patients aren't coming back in for 6 weeks. And so if we can intervene immediately when we find out there's a problem, I'm guessing that at least we can cut that number in half and possibly even further. So it's a huge impact.
And the stuff that makes it into the newspaper all the time is the new drug or the new surgical device or the new robot. But in fact, this kind of sort of health services research, how to do things better, cheaper, faster, is I think where the biggest opportunities are. And if UNC has a particular strength in the medical science arena, it is in that realm because of our collaborations with between the School of Public Health and the School of Medicine, School of Dentistry, Nursing, et cetera.
I have a question. That was wonderful. And it's just interesting. I want to emphasize some of those numbers, like 60% success. These are just how unusual those are cannot be overstated. That's really such a success. I'm interested in both of your perspectives about what we can do to continue to bring new investigators, especially when they have you're a surgeon. You can do other things. All of our docs have another full career that they're also doing. But as you said, without research, it doesn't really advance. This is a kind of program that can give an incentive. Are there other things that we could do that could also encourage investigators to step out of not that I want them to step out of their medical practice, but expand their careers to allow that experimentation and research to be a part of it?
Yeah, I think as it stands, NC-TraCs is a great program, and I don't know if there's much more other than support what they have already created. When I was thinking about what I was going to talk about today, I can't stress how important that is. So what you were saying, that you really get the investigator early before their clinical practice sort of expands, especially as a surgeon, because once you have the clinical practice, it's very hard to cut back because you have all those patients you need to see. So for me, I think what we could be doing is really putting a more emphasis on the very early investigators, those people who are coming in right off the bat. Like I said, I was fortunate to get that in my first year, and that really has changed the course of my career. Had I have received this maybe 2 or 3 years later, it may have been different because my clinical practice has expanded too much. It may have been too overwhelming. Whereas at the very beginning, that protected time and carving that time out at the beginning has really I think, at least for me, had a great impact. So if there was anything, it'd be to target all of these individuals, even at earlier stage, chief resident to, when you're starting on faculty. So that would be my suggestion.
The other thing that I would add, what Angie is doing is really hard to do. She can go into the operating room and cut out somebody's bladder and reroute everything. She can do that day and night. It's almost second nature to her. But this is real-time problem solving over and over and over again to get these research projects launched. And literally, you work for months and years to get to the first step. So the sort of the return, the cycle of pats and rubs that you get isn't quite the same as in the surgical suite. So we have to create a culture where this activity is valued, not only by your boss, but also by your community, by everyone, so that people can carry on, to take the defeats, to keep moving forward, to not give up. To me, the most amazing thing is that over 90% of the Angie Smiths at UNC persist in doing research, because it is a very, very tough road that Angie hoes every day. Well, maybe I'll take that. So the CTSA network, so there's 62 CTSAs across the country. And when we were first established in 2008, our job was to optimize the way that UNC functioned as a research machine in the creating better health in communities arena. That message has changed, particularly over the last 2 or 3 years, into one where our focus needs to be equal at collaborating with these other 62 CTSAs so that the sum of these 62 CTSAs is more than our parts. And so the notion is, if we do something well, we should find partners to see if we can amplify that effort. So we have many, many collaborations with Vanderbilt. We just got funded in the last month for doing a big data effort funded by PCORI, a federal source involving Vanderbilt, UNC, Duke, the Medical University of South Carolina. There may be one other institution, in a parallel effort funded by the Doris Duke Foundation with Wake Forest included in it as well. So, our job now is not just to take care of business at UNC, but to make sure that we engage these other 62 CTSAs in a meaningful way to amplify the effect of the entire program. And I do think it's genius. I mean, we've got our stuff together here at UNC, and we can really accomplish more by working together with these other institutions.
Thank you both. That was remarkable. The results speak for themselves. Some of those numbers are just unbelievable. And thank you for what you do for the university and the citizens in North Carolina.
Thank you.
You also put a human face on big data. Now we know what people do all the looking at data for. And I think that's really fantastic and really appreciate that.